If you're over 60 and you walk for exercise, health, or just to stay independent, I want you to know something important right from the start. Walking is one of the absolute best things you can do for your body, your heart, and your longevity. It's low impact, it's accessible, and it keeps you moving through life with confidence. But there's a subtle mistake that many of us make with every single step we take. And over time, especially as we age, this mistake quietly increases the stress on our knees in a way that can lead to pain, stiffness, and even early joint breakdown. The good news? It's completely fixable, and you can start correcting it today without any special equipment, gym membership, or complicated routine. Before we go any further, I need to be very clear about something. Everything I'm sharing with you in this video is for educational purposes only. This is not medical advice, and it's definitely not a diagnosis. If you're currently experiencing severe knee pain, swelling, instability, or if you've had a recent injury or surgery, please reach out to your doctor or a physical therapist before making any changes to how you move. What I'm going to discuss today is based on widely accepted principles in orthopedic medicine and physical therapy, strategies that professionals recommend to protect your joints and support long-term mobility. My goal is to give you information that empowers you to move safely and confidently, but your individual health always comes first. Now let's talk about why this matters so much, especially after 60. As we age, our bodies go through natural changes. The cartilage in our knees, that smooth cushion that helps our joints glide and absorb shock, naturally thins over time. The muscles around our knees, our hips, and our ankles can lose strength or develop imbalances, especially if we've been less active or if we've favored one side of our body for years. Ligaments become a little less elastic. Our joints simply don't have the same shock-absorbing capacity they did when we were 30 or 40. But here's the critical part. Pain is not just aging. Pain is often a signal that something mechanical is off. And when something mechanical is off, it can often be corrected. For decades, you might have walked a certain way without any problems. But over time, as your joints change, a habit that used to be harmless can start to cause trouble. That's not your fault. It's not about being careless or uninformed. It's simply that the body's tolerance shifts, and what worked before might now be creating stress you can feel. So what is this mistake? It's called overstriding, and it's one of the most common walking errors that orthopedic surgeons and physical therapists see in patients with knee pain, especially in people over 60. Here's what it looks like. When you take a step, your front foot lands on the ground well ahead of your body. Your leg is almost straight, and your heel strikes the ground first, far out in front of your hips. It might feel like you're taking long, powerful steps. It might feel efficient. But biomechanically, it's creating a braking force with every step. Your knee has to absorb that impact while it's in a vulnerable, extended position. Imagine trying to catch a heavy bag while your arm is locked straight out in front of you. Your elbow takes all the force. That's essentially what's happening to your knee with every overstride. Over time, this repetitive stress wears down the cartilage unevenly, increases pressure on the kneecap, and can irritate the tendons and ligaments around the joint. You might notice it as a dull ache after your walk. You might feel stiffness going up or down stairs. You might notice your knees feel tired or unstable after a longer outing. These aren't signs that walking is bad for you. They're signs that the way you're walking might need a small adjustment. Orthopedic surgeons will tell you that when they evaluate patients who need knee replacements or who are dealing with chronic osteoarthritis, one of the patterns they frequently observe is years of walking with poor mechanics. It's not that walking caused the problem. It's that walking with too much impact in the wrong places accelerated the wear and tear. Physical therapists see this too. They work with patients every day who say, "I've been walking my whole life. Why does it hurt now?" And the answer is often in the gait pattern. The professionals wish, more than anything, that patients had learned earlier how to walk in a way that protected their joints instead of stressing them. But you're here now, and that means you have the chance to make a change that can genuinely protect your knees and keep you walking comfortably for years to come. So let's talk about the correction. Instead of reaching your foot far out in front of your body with every step, the goal is to land your foot closer to your center of mass, right underneath your hips. Your knee should have a slight bend when your foot makes contact with the ground. You're not shuffling. You're not taking tiny steps. You're simply landing with your foot closer to your body and allowing your knee to stay soft and flexed. This does a few important things. First, it reduces that braking force. You're not slamming the brakes with every step. Second, it allows your muscles, especially your quadriceps and hamstrings, to absorb the shock instead of forcing your joint to do all the work. Third, it keeps your knee in a stronger, more stable position throughout your stride. Think of it like this. When you walk down a steep hill, you instinctively take shorter steps and keep your knees bent because it feels more controlled. That's your body protecting your joints. We want to bring a little bit of that protective instinct into your everyday walking, even on flat ground. Here's how to practice it safely. Start with just a few minutes during one of your regular walks. Pay attention to where your foot lands. Does it feel like it's reaching way out in front? If so, shorten your stride just a bit. Let your foot land underneath you. Keep a gentle bend in your knee as your heel touches down. Your steps might feel a little quicker, a little lighter. That's good. You're distributing the work across more steps instead of loading everything into fewer, heavier impacts. Don't overthink it. Don't try to change everything at once. Just bring a little awareness to each step. It's really important that you don't overcorrect. Some people hear this advice and start walking stiffly, or trying to land flat-footed, or taking steps that are too short and choppy. That can create new problems. The goal is natural, comfortable, and controlled. If something feels awkward or painful, ease up. Your body needs time to adapt. Muscles that haven't been working as hard will need to build endurance. Your balance might feel slightly different at first. That's okay. Give yourself a few weeks of gradual practice. Use short, familiar routes where you feel safe and confident. And listen to your body. If you feel a new ache or strain, that's feedback. It doesn't mean you're doing it wrong. It just means you might be pushing too hard too soon. Rest when you need to. Alternate between practicing your new gait and walking however feels most comfortable. Over time, this new pattern will become second nature, and your knees will thank you. Now, walking mechanics are crucial, but they're not the only factor in protecting your knees. Let's talk about a few other evidence-backed habits that support everything we've just discussed. First, footwear. You don't need expensive orthotics or the latest trendy shoe, but you do need shoes that fit well, provide adequate cushioning, and support your natural foot movement. Worn-out shoes with flattened soles don't absorb shock, and that means your knees have to. If your shoes are more than a year old and you walk regularly, it's worth considering a replacement. Look for something with a supportive heel counter, a flexible sole, and enough room in the toe box. The surface you walk on also matters. Concrete and asphalt are hard and unforgiving. If you can, mix in some walks on softer surfaces like grass, dirt trails, or rubberized tracks. Your knees will experience less impact. If you're limited to pavement, that's okay. Just pay extra attention to your stride and your footwear. Warming up before your walk might sound unnecessary, but it's one of the simplest ways to prepare your joints and muscles for movement. You don't need a formal routine. Just a few minutes of gentle movement, marching in place, easy leg swings, or slow walking before you pick up your normal pace. This increases blood flow, lubricates your joints, and reduces the chance of strain. And here's something that might surprise you. The strength of the muscles around your knee plays a huge role in joint health. Your quadriceps, hamstrings, and even your hip muscles stabilize and protect your knee with every step. If those muscles are weak, your knee joint has to work harder. I'm not suggesting you start an intense workout regimen, but gentle strengthening activities, whether it's standing up from a chair without using your hands, simple leg lifts, or even water-based exercise, can make a real difference. A physical therapist can guide you on safe, effective exercises tailored to your needs. Now let's clear up a few myths that unfortunately cause a lot of harm, especially for seniors. The first one is this: pain is just part of getting older, so I should ignore it. That's not true. Pain is your body's alarm system. It's telling you something needs attention. Yes, our bodies change with age, but chronic pain is not inevitable, and it's not something you just have to live with. If your knees hurt when you walk, that's worth investigating and addressing, not dismissing. Another myth: the more I walk, the better, even if it hurts. Walking is wonderful, but more isn't always better, especially if your form is causing harm. Quality matters more than quantity. A shorter walk with good mechanics is far better for your knees than a long walk that's grinding down your joints. And if something hurts, pushing through it doesn't make you tougher. It just increases your risk of injury. Finally, some people believe that if their knees hurt, they should stop walking altogether and rest indefinitely. Unless you've been specifically told by a doctor to avoid walking due to an acute injury, prolonged inactivity usually makes things worse. Your joints need movement to stay healthy. Cartilage gets its nutrients from the fluid that moves through the joint when you walk. Muscles weaken without use. The key is not to stop moving, but to move smarter. I want to leave you with this. No matter how long you've been walking a certain way, no matter how much discomfort you might be feeling right now, improvement is possible. Your body is remarkably adaptable, even after 60, even after 70, even after 80. Small, thoughtful changes in how you move can reduce pain, protect your joints, and keep you active and independent for years to come. You don't have to accept limitations. You don't have to give up the activities you love. You just have to be willing to learn, adjust, and give your body the respect and care it deserves. Walking is freedom. It's connection. It's health. And you have every right to enjoy it without pain. If this video was helpful, I'd love to hear from you in the comments. Have you noticed knee pain when you walk? Have you tried adjusting your stride? What's worked for you? Your experience might help someone else who's struggling with the same thing. And if there are other topics related to safe movement, balance, strength, or staying active as we age that you'd like me to cover, let me know. I'm here to support you with information that's practical, evidence-based, and respectful of where you are in your life. Thank you for being here. Thank you for taking your health seriously. And most of all, thank you for continuing to move, to care for yourself, and to live fully. Keep walking. Just walk a little smarter.